Allopurinol is a xanthine oxidase inhibitor used to reduce urinary and serum uric acid concentrations in patients with gout, recurrent calcium oxalate calculi, and various malignancies. In this video, let's found. What is allopurinol? What is allopurinol used for? Contraindication. What are the side effects of taking allopurinol? How does allopurinol work? How to use allopurinol? Allopurinol is a xanthine oxidase inhibitor used to reduce urinary and serum uric acid concentrations in patients with gout, recurrent calcium oxalate calculi, and various malignancies. In this video, let's found. What is allopurinol? What is allopurinol used for? Contraindication. What are the side effects of taking allopurinol? How does allopurinol work? How to use allopurinol? What is allopurinol used for? Allopurinol is indicated in 1. The management of patients with signs and symptoms of primary or secondary gout, acute attacks, tophi, joint destruction, uric acid lithiasis, and/or nephropathy. 2. The management of patients with leukemia, lymphoma, and malignancies who are receiving cancer therapy which causes elevations of serum and urinary uric acid levels. Treatment with allopurinol should be discontinued when the potential for overproduction of uric acid is no longer present. 3. The management of patients with recurrent calcium oxalate calculi whose daily acid excretion exceeds 800 mg per day in male patients and 750 mg per day in female patients. Therapy in such patients should be carefully assessed initially and reassessed periodically to determine in each case that treatment is beneficial and that the benefits outweigh the risk. Contraindication. Patients who have developed a severe reaction to allopurinol should not be restarted on the drug. A few cases of reversible hepatotoxicity have been noted in patients taking allopurinol, and in some patients asymptomatic rises in serum alkaline phosphatase or serum transaminase have been observed. Side effects: blurred vision, burning pain, changes in skin color, cough, difficulty with moving, hair loss, rash, agitation, body aches or pain, bruising, congestion, irritation of the eyes, swelling of your face or throat, trouble breathing, change in taste. Pharmacodynamic. Allopurinol decreases the production of uric acid by stopping the biochemical reactions that precede its formation. This process decreases urate and relieves the symptoms of gout, which may include painful tophi, joint pain, inflammation, redness, decreased range of motion, and swelling. Mechanism of action. Allopurinol is a structural analog of the natural purine base, hypoxanthine. After ingestion, allopurinol is metabolized to its active metabolite, oxapurinol, alloxanthine, in the liver, which acts as an inhibitor of xanthine oxidase enzyme. Allopurinol's active metabolite inhibits xanthine oxidase, the enzyme that converts hypoxanthine to xanthine and xanthine to uric acid. Inhibition of this enzyme is responsible for the effects of allopurinol. This drug increases the reutilization of hypoxanthine and xanthine for nucleotide and nucleic acid synthesis by a process that involves the enzyme hypoxanthine guanine phosphoribosyltransferase, HGPRTase. This process results in an increased nucleotide concentration, which causes feedback inhibition of de novo purine synthesis. The end result is decreased urine and serum uric acid concentrations, which decreases the incidence of gout symptoms. Accompanying the reduction of serum uric acid by allopurinol is an increase in the serum and urine concentrations of hypoxanthine and xanthine, due to inhibition of xanthine oxidase. In the absence of allopurinol, regular urinary excretion of oxapurins almost entirely occurs in the form of uric acid. Half-life. The plasma half-life of allopurinol is 1 to 2 hours, due to its rapid renal clearance. Dose. Gout. Mild, 100 mg per day (PO) initially, increased weekly to 200 to 300 mg/day. Moderate to severe, 100 mg per day (PO) initially, increased weekly to 400 to 600 mg/day. Antineoplastic-induced hyperuricemia. PO, 600 to 800 mg divided Q8-12HR, starting 1 to 2 days before chemotherapy. 4. 200 to 400 mg/m superscript 2/day, not to exceed 600 mg per square meter per day, may administer a single infusion or in equally divided doses at 6, 8, 12-hour intervals beginning 1 to 2 days before chemotherapy. Safety advice. Allopurinol is categorized as pregnancy risk C by the FDA as it inhibits purine synthesis and hence may have direct effects on dividing cells in utero. It is excreted in breast milk and caution is advised when used in nursing mothers. That's all the information about allopurinol we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.